comes to mind when I say CPR? We associate CPR with emergency situations and critical life-saving. CPR is one of the most important and universally practiced first aid methods in the world. CPR is the first and only treatment proven to save life in a cardiac arrest victim until help arrives. CPR was invented by Australian surgeon Peter Schaefer. He combined 3 existing methods in one: mouth-to-mouth resuscitation, head tilting, and chest massage. These form the basics that will become the famous CPR technique. I'm sure most of us at some point in time have seen CPR being used on a TV show, or like one of the current ER hospital-based dramas, or even seen it firsthand. The great part about CPR is once you are trained and know the basics, doing something is better than nothing, and you're protected by the Good Samaritan Law, which is described by uslegal.com as laws which grant immunity. If the Good Samaritan makes an error while rendering emergency medical care, he or she cannot be legally liable for damages in court. There is, of course, the little red tape. 2 considerations usually must be met. The aid must be given at the scene of an emergency, and if the volunteer cannot have other motives, such as being paid. What could be more special than the ability to make a life-changing difference and know how to respond in the event of emergency, and perhaps save someone you love and care for? The Red Cross said, sudden cardiac arrest claims the lives of more than 200,000 people in the U.S. every year. I am trained in CPR and first aid under the guidelines for the American Heart Association and have been for the past 6 years. I've worked in the medical field for the past 9. I'll explain how to perform CPR in 4 basic steps: call, blow, pump, and blow. I'll explain the ratios of CPR for adults. Let's start with the most important thing, which is to determine if someone needs CPR. The first step, call. First you must make sure that there is a need for CPR. This can be determined by a simple evaluation of the person. Check the victim for responsiveness. If the victim is not responsive and not breathing, or not breathing normally, the way you do this is to place your ear close to the victim's mouth and place your hand on the chest. Feel for any air coming from the nose and feel for the chest to rise. If you can't feel air or chest to rise, take the first steps. If you're alone, call 911 and return to the victim. If you're with someone, designate that person to call 911. In most locations, the emergency dispatcher can assist you with CPR instructions. Once you have dialed 911, it is time to move on to step 2, blow. Step 2 is called blow. After you've established the victim is unresponsive and not breathing on their own, you need to ensure that the airway is not obstructed. And to do this, you tilt the head back and place one hand on their nostrils and plug their nose. Then place your mouth over their mouth and provide a rescue breath. Notice to see if the victim's chest rises. If their chest rises, you are providing an accurate amount of rescue breath. If their chest rises, you repeat with another rescue breath. After the 2 rescue breaths, you need to assess the victim has a pulse. You do so by placing 2 fingers on the neck where the carotid artery is, and assess for about 10 seconds to ensure that there is no pulse present. If there is a pulse, continue to do step 2, blow, and just provide rescue breaths. Now that you know how to assess the victim and how to provide a rescue breath, our next step to learn is step 3, pump. Step 3 is called pump. If the victim still is not breathing normally, coughing or moving, and does not have a pulse, you need to begin chest compressions. Use both hands palm downwards and interlock your fingers, and push down in the center of the chest about 2 inches, and press down and up 30 times. Pump hard and fast, the rate of at least 100 per minute, faster than 1 per second. The American Heart Association says the most effective rate for chest compressions is greater than 100 compressions per minute, the same rhythm as the beat of the Bee Gees song Staying Alive. This can become very exhausting fast, but the rush of the moment aids in providing you energy. If you're not alone with the victim while you're doing your compressions, you can have someone else place their fingers on the carotid artery and ensure that there is a pulse. Each compression should produce a pulse. This step is very important for survival. With each compression, you're providing artificial heartbeat and circulating blood to the brain and the rest of the vital organs and keeping them oxygen-rich and delaying them from death. Now that you've provided 30 compressions, it's time for step 4, blow. In step 4, you again tilt the head back, pinch the nose, cover the mouth with your fingers, and blow until you see chest rise. Give 2 breaths. Each breath should take 1 second. Continue with 30 pumps and 2 breaths until help arrives. This ratio is the same for 1 person and 2-person CPR. Now that you know the basics of CPR, you can make the difference in someone's life and perhaps even save a life. According to American Red Cross, less than 1/3 out of hospital sudden cardiac arrest victims receive bystander CPR, and effective bystander CPR provided immediately after sudden cardiac arrest can double or triple a victim's chance of survival. So today I've showed you how to do 4 basic things, which can be summarized by remembering CBPB. which are call, blow, pump, and blow. Remember, the most important part of CPR is doing something. Anything is better than just standing there. If you do not feel comfortable to do mouth-to-mouth, there are options, such as placing a towel over their mouth first, or you can use a face shield. If you do not feel comfortable, then at least do compressions, and this will aid in the flow of blood to the vital organs until help arrives. Remember first to check the victim's responsiveness. If unresponsive, call 911. Get help on the way ASAP. Then remember to provide rescue breaths and be sure to see chest rise to ensure that the victim is not unresponsive due to blockage in the airway. And then do your chest compressions, 30 of them. Then repeat 2 breaths and 30 compressions until emergency response professionals arrive. So the next time you happen across someone unresponsive or someone you know suddenly falls out in front of you, now you know the basic steps of providing CPR. You can make the difference and provide the gift of life.